Hello guys and welcome to Meden Tutorials. In today's presentation, we will be discussing the vital signs. But before we begin, there are some few questions I would like us to answer. Question 1. What are vital signs? Question 2. Name the primary vital signs. Question 3. What is the normal body temperature? Question 4. In which way or ways can body temperature be taken? Question 5. What is the most reliable method of taking temperature? Question 6. What is the normal heart rate of an adult? Question 7. A lower than normal heart rate is called. Question 8. A higher than normal heart rate is called. Question 9. Name at least 5 sites of checking pulse and how to describe that pulse. And lastly, but not the least, question 10. What is the normal blood pressure of an adult? So these are questions. As we move through the presentation, you need to be answering them if you don't have the answers to them now. Now the main meat. Vital signs. These are signs that are measurement of the body's basic functions. Measurement of the body's basic functions. Vital signs are also known as the cardinal signs because they are considered the most fundamental and essential indicators of a person's health status. The 4 standard primary vital signs are as follows. 1. Temperature. 2. Pulse, also known as the heart rate. 3. Respiration. And then 4. Blood pressure. So these are the 4 basic or primary vital signs. However, there are other vital signs you need to know as well. So 5, we have oxygen saturation. 6, we have blood sugar or glucose. And lastly, we have pain rating. Pain rating is very, very important because knowing the pain rating of the individual can affect a lot of these factors or vitals we mentioned earlier on. For example, somebody with a pain rating of 9 to 10 can definitely have an increased blood pressure and, of course, pulse rate as well. So it's very, very important in knowing the pain rating of the person you'll be examining or the individual. Now let's move to each and every vital. Let's start off with temperature. Temperature is a measurement of heat expressed in degrees. Body temperature is the difference between the heat or energy generated by the body processes and the amount of heat lost to the external environment. Mathematically, body temperature is equal to the heat produced minus the heat lost. The normal body temperature of a person varies depending on some factors such as gender, recent activity, food and fluid consumption, the time of day, and in women, the stage of the menstrual cycle. In all these, the normal body temperature can range from 97.8 degrees Fahrenheit, which is equivalent to 36.5 degrees Celsius to 99 degrees Fahrenheit. That is 37.2 degrees Celsius for a healthy adult. A person's body temperature can be taken in any of the following ways. 1. Orally. Now, temperature can be taken by mouth using either the classic glass thermometer or the more modern digital thermometers that use an electric probe to measure body temperature. 2. Rectally. Temperatures taken rectally, that is usually using a glass or digital thermometer, tend to be zero point 0.5 to zero point 0.7 degrees higher than when taken by mouth. 3. Axillary or the armpit. So temperatures can be taken under the arm using a glass or a digital thermometer. Temperatures taken by this route tend to be zero point 0.3 to zero point 0.4 degrees lower than those temperatures taken by mouth. 4. By ear. So a special thermometer can quickly measure the temperature of the eardrum, which reflects the body's core temperature. That is the temperature of the internal organs. Fifth one is by skin. So a special thermometer can quickly measure the temperature of the skin on the forehead. An example of such thermometer is the gun thermometer, which is now widely used in many parts of this country or other world. Take note of the following. The best route of temperature in children is axillary. However, the most reliable method is the rectal route. The rectal route. Armpit temperatures are the least accurate, but are useful for screening at any age. And probably because of how comfortable it is and convenient, it is widely used than the rectal route. You should not use a thermometer to take an oral temperature after it has been used to take a rectal temperature. The next vital is pulse. Pulse is simply the wave of blood formed by the contractions of the left ventricle. The pulse rate is the rate at which the heart beats while pumping blood through the arteries, recorded as beats per minute, BPM. The normal pulse rate ranges from 60 to 100 beats per minute in adults. In children, it ranges from 70 to 130 beats per minute. In newborns, it ranges between 100 to 160 beats per minute. Pulse less than 60 beats per minute is called bradycardia, whereas pulse greater than 100 beats per minute is called tachycardia. Site of taking pulse. There are various sites to help you take pulse. Some of these sites include 1. The temporal. It is felt in the head. 2. The carotid. It is felt in the neck. We have brachial. It is felt in the elbow. We have femoral. It is felt at the groin. We have radial. It is felt on the wrist. We have popliteal. It is felt on the knee. And then we have the dorsalis pedis. it is felt on the foot. These are some key points to include when commenting on pulse. 1. The rate. So over here, state the number of beats per minute. 2. The rhythm. So the rhythm describes whether the pulse is regular, that is even intervals between beats, or irregular, that is uneven intervals between beats. Third point is the amplitude or the strength. Over here, you use a grading system. Example, grade 0 means absent strength, +1 means weak amplitude, +2 means normal amplitude or strength, and then 3 plus or +3 means it is pounding. This is to indicate the strength of the pulse, basically. Then we have the character. Over here, it describes the quality of the pulse wave, including terms like bounding, that is strong and rapid. Or another way of describing or giving its character is weak, which means that it is difficult to feel. And then we have what to call pulsus alternans, which means alternating strong and weak beats. As simple as that. Then the last way of commenting on pulse is symmetry. So over here, you compare the pulses on both sides of the body to check for equality. To check for equality. Now, respiration. This is simply the act of breathing. It includes the intake of oxygen and the output of carbon dioxide, or inhalation of oxygen and exhalation of carbon dioxide. The normal breathing rate in adults is between 120, between 12 to 20. In children, it is between 20 to 30. And in infants, between 30 to 60. Medically, normal breathing means eupnea. Absence of respiration or breathing is called apnea or apnea. Then respiratory rate of more than 30 is called tachypnea. And then respiratory rate of less than 10 is known as bradypnea. Bradypnea. All right. Now, let's move to blood pressure. Blood pressure. This is simply the force exerted by the blood against the wall of the blood vessels. Blood pressure readings are measured in millimeters of mercury, mmHg. It is measured as two numbers separated by a slash, such as 120/80 millimeters mercury, or mmHg. Now, the first number is the systolic pressure, which is the numerator. Now, this is the force of blood when the heart pumps. And the second number is the diastolic pressure, which is measured between heartbeats. That is when the heart relaxes to take in more blood. Hopefully in future, videos will be made to discuss the heart cycle. Now, according to the American Heart Association, blood pressure can be classified into the following: 1. Low blood pressure. This means that the blood pressure is less than 90/60 millimeters mercury. In normal blood pressure, it is less than 120/80 millimeters mercury, but of course, not less than 90/60. So it's a range. It is never a single value, as many of you might think. Then we have elevated blood pressure. Elevated blood pressure. It has a systolic of between 120 to 129 and a diastolic of less than 80. I repeat, elevated blood pressure has a systolic between 120 and 129 and diastolic less than 80. The third classification of blood pressure is hypertension stage 1. That is systolic between 130 and 139. 130 to 139. And a diastolic between 80 to 89. That gives you hypertension stage 1 or pre-hypertension. Then we have hypertension stage 2. That is 140 or higher for the systolic value and then 90 or higher for the diastolic value. And then we have hypertensive crisis. That is a systolic higher than 180 and a diastolic higher than 120. So basically, these are the classifications of blood pressure according to the American Heart Association. So basically, these are the 4 major vital signs that we have discussed. To encourage us, help us to share and subscribe if you have not yet subscribed to this channel. Thank you and see you in my next video. Peace out.